potentially 20 patients in there. And that helps us in many, many ways. We notify the hospitals what we have coming, and we try to separate some of our patients. So we take many of the patients that are critical to having the level 1 trauma center for pediatrics. Then we take some to Children's Hospital that are less critical, and then we took some to North as well. So our whole team, our surgeons, the ED, everybody did a fabulous, fabulous job. But yes, it's really still tough on that team. You know, some people have asked how do you triage the patients on the scene, so it's a really quick, with in situations like this, it's pretty quick if they're conscious or not, if they have gunshot wounds to the upper body of the head, they're obviously red patients. Other people are going to be yellow patients. We try to load up one red patient, maybe 2 or 3 yellow patients in the ambulance, take them to the hospital. That all worked really, really well. Great response from our police, fire departments, other EMS services. And like I said, we train for this. Most of us all have kids, so it's still really, really hard for our team. But they're doing pretty well. We gave most of the people the day off today that were there yesterday, but they'll come back to work and do the same thing over again. So, should I answer questions or sit up right here? Yeah, questions later. Thank you.
Good morning, everybody. My name is Dr. Aaron Robinson, AARON, ROBINSON. I'm the Assistant Medical Director at Hennepin EMS, and I'm also an emergency physician at Hennepin Healthcare. Yesterday was an incredibly tragic day. The medical directors were paged out a couple minutes after this had happened. And part of our job is to relay information and be a liaison between the hospital systems and the providers on scene. The earlier you activate a mass casualty incident, the better. We can mobilize resources faster, and we can get the folks and the equipment there that are needed to help best care for our most critical trauma patients. When I was en route, I contacted EMS Command, and they had information from police that were going to be upwards of 20 victims or more. With that information and the resources that I knew that healthcare had provided, I activated the MCI within a couple of minutes after knowing that, just to get resources mobilized and to get the folks there that needed to be in the upstaff emergency department for patients to be received. In trauma, when you're talking about caring for a trauma patient in the pre-hospital setting out in the field, minutes and seconds matter. And our job in the pre-hospital setting is to perform life-saving interventions like stopping the bleeding or helping somebody breathe. But every minute that the trauma patient spends on scene, it increases their chance of not having a good outcome and possibly dying. So I have a huge credit to the Minneapolis Police Department and the other first responders that entered the scene and secured it quickly. The scene was safe in a few minutes after the initial incident, and I credit our brave first responders for doing that. That allowed us to get the patients in and to get them to definitive care very, very quickly. Those swift actions undoubtedly saved the lives of many of those children.
Everybody, my name is Dr. Tom Wyatt, W-Y-A-T-T. I'm Chair of Emergency Medicine at Hennepin Healthcare. You know, the emergency department is the front door to our entire safety net organization. And while we deal with emergencies every day, it takes a lot of planning, preparedness, exercises, drills throughout the year to deal with an event such as what we experienced yesterday. So it was really very, very helpful to us, as Dr. Robinson mentioned, to get that pre-notification of the types of the numbers and the types of injuries that we're going to experience. And that allowed us to mobilize the appropriate resources. Here at Hennepin, you know, as a level 1 trauma center, both for adults and pediatric patients, we're able to mobilize a lot of resources very quickly. Luckily, this happened during the daytime and not the evening, so it was a lot easier for us to quickly mobilize some of those resources. The amount of resources and the amount of organization it takes to assemble those teams so that we can have a team ready for a patient when they come into our emergency department, when they arrive via EMS, is very impressive. And as I stated yesterday, I'm really proud to be part of this organization and all of the different components of the teams that we had yesterday. I listed some yesterday, and I know I missed some people, so I won't try to list them all, but there's a number of different specialists that come down to help us for these types of events. After the MCI response was over. As emergency providers, we unfortunately don't get to stop what we do. We have to continue working. We have to continue to see the patients that are continuing to arrive to the emergency department. We have to continue to work the shifts that we are already there for, and that can take a toll as well. Once you try to process what you experienced in a mass casualty event such as this. So again, we received an outpouring of support from the local communities from across the nation. I've received messages and support from chairs of other emergency departments across the country. It's just been very meaningful to us and our teams. So thank you for that. I want to introduce Dr. John Gakin, who's one of our head trauma surgeons.
Hello, everybody. Thanks for coming today. My name is John Gakin. I'm a trauma surgeon, Jon, G is in George, Ayken. A lot has been said and a lot has happened over the last 24 hours. And the impact of yesterday's events will be felt throughout this community, to the country. And most notably through our hospital organization and the people that I work with. But I think it goes most importantly to be stated that this is really about the families and the people that were impacted at the shooting yesterday, and that we are just here to support them. I think the main message that I can portray is that, we like to stand here at the hospital just sort of quietly waiting and being ready for whatever the hospital or the community needs. And unfortunately, yesterday is something that I didn't think I would ever have to be part of. So I don't really have good words to describe it. But everybody in this hospital and this organization was there, and down to the EMS, or the housekeepers, the nurses that weren't even part of the, I'll tell a quick story because it emphasizes it. One of the victims came in the emergency department. This was a nurse manager from another unit, didn't have anything to do with what we would normally respond to. And one of the children were very scared and alone because everybody was running about and doing their jobs. And she went into the CT scanner with the patient, putting herself basically in harm's way of radiation, which normally would evacuate the room. She put a little lead on and stayed there and held her hand and then held her hair while she went through the scanner so she didn't have to go through it alone. Those are the types of things we witnessed yesterday. I don't know that we can describe what they went through and what the actual events were like, nor I think we're supposed to be able to do that. But we can describe the things we saw from our team members and from our hospital. And it was as inspiring, as preserving for me as I can put words together. Taking care of one child that's injured is difficult. 8 of them is nearly impossible, but it happened yesterday. And so the teams that came together, that worked after the patients went out of the emergency rooms and they were triaged, the pediatricians, the neurosurgeons, the therapists, the pharmacists, sure I'm missing the medicine doctors, the other surgeons from other hospitals, our team, the outpouring of support from friends and family, past residents, past medical students, people that just know what's going on. So I can't say enough. Thank you for the support. Our teams will need it.
Okay, then we'll answer some questions if anybody has some from anybody here.
Just to make sure I say that at one point we had 10 patients coming in with gunshot wounds. I think it said about 4 of them needed surgery. I would almost assume 10 patients with gunshot wounds, all of them need surgery. What differentiated those that stayed in the ER for treatment and those that were able to that required surgery?
I'll jump right. One thing we're really blessed with here is our surgeons come down to the ED right away, and so I'll let the surgeons talk about it, or maybe.
Yeah, I think the way the trauma process in our hospital and many around the country is, the patients are met and greeted. EMS gives updates to the emergency department physicians. They have an opportunity if they think that something is going to be required, they think might require surgery, or if something develops when surgery is needed. But yeah, as they activate us, we come down and we work together. So it's the emergency department and our surgery trauma team interfacing with the patient and the condition together. And then once the decision is made that they have a surgical sort of need, make efforts to get to the operating room. So the triage process happens real time and together. But then once they go into surgery, you know, we a lot of times we take them up to surgery. We do whatever surgery they need. And some gunshot wounds, to answer your question, don't always require surgery. Some can be managed what we call non-operatively. And those sometimes have to do with extremity injuries that don't involve blood vessels, that may not involve the bones, but sometimes they will heal maybe if it's not a fracture that requires orthopedic involvement. But there are areas of the body, the chest and abdomen, where need exploration, or sometimes in the head, of course. So there were some of those patients yesterday, and some required emergent operations, and they underwent that.
Can you give an update on the condition of victims?
I mean,
Yeah.
I'm going to leave that to the...
Yeah, I mentioned at the outset that we have 6 patients that are in satisfactory condition, 5 children. We have 2 in serious condition, 1 adult, 1 child, and 1 patient that in critical condition as a child. Correct. I believe 1 patient was discharged.
Yeah,
Started with 10.
yeah, we're discharging 1, maybe 2 this morning.
2 in serious and 1 in critical condition.
One critical. Thank you. The 2 in serious are expected to survive?
Yes, I believe so. I think it's more touch and go. I'd rather not share more detail at the present.
I have a question for the doctor. Really appreciate you sharing, well, it's actually the story about a member of the healthcare team who was there just supporting Kobe, because I think the entire nation is feeling a bit of that. And as you said, your attention is on the families, and I understand that a member of your team was both working as a healthcare provider and a mother. Can you tell us anything about the critical care pediatric nurse, Amy Jean Dreyer, and her actions yesterday?
We can't. I mean, our structure of how we protect patients and families doesn't allow us to comment specifically on circumstances. I'm sorry.
Understood.
Yeah.
I just wanted to give you an opportunity to praise one of your own.
I'm going to defer. I would say all the families are asking for prayers and support, so that's about as much as I'm willing to share.
We did have a number of people that had children at the school. One of our paramedics has a student there. I know several nurses have students there, so it was impactful for the organization.
Thank you.
What was the initial response like? How many EMS personnel, how many ambulances, how did you send up?
So the question is, how many people responded to the scene? So initially it came in as the active shooter, so we activated Plan 1, which normally gets us about 6 ambulances and a supervisor and a doctor. But when we heard the 20 patients potential, then we go to Plan 3, which gets us about 20 ambulances. All of our medical direction team, everyone, and we have some mutual aid from other sources also back up our system. So we had a really, really great response. Our team was actually at Station 27, which is like 3 or 4 blocks away. And so we were ready to go. We waited for the police to give us the okay to come in, and push it just a minute or 2. And then we were on scene right away, and we started transporting right away. And I think we transported the first patient within less than 10 minutes of the call, the time the call came in. And then I think we're done transporting people after 25 minutes from the time the call.
20 ambulances, how many people?
I think we ended up using a dozen or so ambulance and transport 17, I believe was the number. The 3 different area hospitals. Other questions?
And to follow up on
Please.
your point, can you tell us more about how the community, and specifically here at Hennepin Healthcare, given the connection to the school, how they're dealing with this?
I can't speak, everyone deals with it individually differently, but I know our team is really resilient and strong, but you can train for this all you want, but ultimately it's still really challenging for little kids. Yeah, it's hard.
And we would add, in terms of grief and handling trauma, it's day 2, 3, 4, 5, 6, where it starts to slow down and those deeper thoughts start to come. So we're supporting our teams. They're heroes over there, but they're human also. So.
Yeah, and we have a great mental health resources as well. We have our psychiatric people come to and met with the team. We do a hot wash. We have them chat with all the individual providers. We have other mental health resources in there. But it's usually, days or weeks later that really kind of hits home to everybody. And so we'll see how it goes. But, with kids, it's just, once again, a different element of the process that makes it more challenging. I think kids, and also when you get other first responders that are injured, that also is challenging. So, but I think overall our team is doing really well. We have a lot of trauma that happens and a lot of gunshot wounds. This one's just a little bit different though. Other questions from anybody?
Could you address some of the efforts that were made on site in terms of life-saving measures that made the difference in terms of time to get the patients to the hospital?
Sure, I'll let Dr. Robinson address that.
Yeah, and beyond the overall majority of these shooting type scenarios, police are the ones that actually apply the tourniquets. And that is a major key in trauma care to stop the bleeding. When we're dealing with a trauma patient, the first step is to stop the bleeding because they're not going to survive if they continue to bleed even for a few minutes. So the first couple steps is applying tourniquets to extremities to stop the bleeding, and then applying pressure to other wounds that are maybe in the torso or in the trunk, as well as applying seals over any holes that we might find in the chest from bullets or knives or anything. Those are the key things for initial life-saving measures, followed by helping people breathe if they're not breathing effectively, and then transporting them to the hospital.
So